Catherine Amirfar.
And I'm Cal Raustiala.
And this is International Law Behind the Headlines, coming to you from
the American Society of International Law.
Welcome to another episode of International Law Behind the Headlines. In the wake of the devastating COVID-19 pandemic, the World Health Organization's 194 member countries decided on an initiative to draft a pandemic treaty. The global response to the COVID-19 pandemic has been described by the Director General of the World Health Organization, Dr. Tedros, as a me-first approach that was self-defeating and saw issues including unequal access to vaccines and a lack of information sharing that left vulnerable populations at risk. According to a 2021 statement by the President of the European Council, which was signed alongside 20 world leaders, including Dr. Tedros, the pandemic treaty was envisioned as a framework that would ensure, and I'm going to quote, transparency and cooperation going forward, and that the main goal of this treaty would be to foster an all of government and all of society approach, strengthening national, regional, and global capacities and resilience to future pandemics. This includes greatly enhancing international cooperation to improve, for example, alert systems, data sharing, research, and local, regional, and global production and distribution of medical and public health countermeasures, such as vaccines, medicines, diagnostics, and personal protective equipment. So let's talk about where we are 2 years later. After a series of intense negotiations, WHO member states announced just this last May 24 at the 9th meeting of the intergovernmental negotiating body that while agreement was reached to amend the international health regulations, there were areas of non-convergence and divergent views still remaining around the pandemic agreement. Diplomats privy to the negotiations reported, and I'll quote, vast differences over the sharing of information and technologies. And in his closing remarks, co-chair Roland Dries of the Netherlands stated that, quote, the next steps in this essential process will now be guided by the World Health Assembly. And so where are we now? The 77th World Health Assembly was held in Geneva from May 27 to June 1. Reports of that assembly were encouraging and noted some historic points of agreement, including a decision to conclude the pandemic treaty within a year at the latest. Dr. Tedros said afterwards in a sobering message, and I'll just quote him, the decision to conclude the pandemic agreement within the next year demonstrates how strongly and urgently countries want it, because the next pandemic is a matter of when, not if. So I have today with me two senior legal officers of the WHO. I'm just so thrilled to have them here. They're both on the front lines of the pandemic treaty negotiations. First, I have Stephen Solomon, a principal legal officer, international, constitutional, and global health law in the Office of the Legal Counsel of the WHO. Prior to joining WHO, Stephen practiced law with a private firm in DC and in the legal office of the US State Department. I also have Kenneth Piercy, who's a senior legal officer in the international, constitutional, and global health law in the Office of the Legal Counsel of the WHO. Prior to joining WHO, Kenneth practiced law with a private firm in New York and with the Global Fund to fight AIDS, tuberculosis, and malaria. And of course, the views of our guests today do not represent those of the World Health Organization. Stephen, Kenneth, I'm just delighted to have you here. I've worked with both of you in different contexts, and I can't think of two more informed experts to talk us through these issues. So welcome.
Thank you. Thank you so much, Catherine. It is a pleasure to be here.
Indeed. Thank you very much.
So, Stephen, I want to start with you, and I've done obviously some table setting to just catch everyone up on what has happened, and obviously the import of the most recent World Health Assembly. From your perspective, what issues have been at the forefront of negotiations around the pandemic treaty, and how did they manifest in the World Health Assembly just weeks ago?
Catherine, first of all, again, pleasure to be here. This is an issue which we're very happy has received a lot of attention because the impact of the COVID-19 pandemic was so enormous. And I just, before I go into those key topics that are really addressed in the pandemic agreement, let me just, if I may, build on what Director General Tedros has mentioned in terms of the importance of equity in responding to future pandemics based on lessons learned from the COVID-19 pandemic. So you can look at the costs of the shortcomings in the world's response to the COVID pandemic. You can look at it in terms of lives lost. You can look at it in terms of well-being compromised. You can look at it in terms of setbacks in other metrics of public health, which were, as we should recall, quite enormous. There were enormous impacts in other healthcare areas because of the response to the pandemic. So those costs can be modeled and measured, and they are, and they're offering guidance for governments and their delegations in Geneva on ways to address future pandemics, and not just COVID-type pandemics. The importance of future-proofing against all possible pandemics is key. But those modeling efforts have included modeling on a key issue of equity, which is distribution of vaccines and other countermeasures. And I want to, for your listeners, refer to a October 2022 article in the journal Nature Medicine. And that October 2022 article in the journal Nature Medicine modeled the effect of increased global vaccine sharing on the pandemic. And what the model suggested, among other things, was that distributing COVID-19 vaccines more fairly with lower income countries might have saved more than 1 million lives. Moreover, public health-based vaccine allocation might have also blunted the spread of COVID variants, which could have potentially reduced the pandemic's impact on all countries and all populations, whether rich or poor. So let me quote, and then I'll answer your question. Let me quote from the authors of the article, because their conclusion is important, and it's a driver of the discussions in Geneva. Their conclusion was, quote, "The message for any emerging outbreak is clear. Distributing vaccines across the globe proportional to need rather than to wealth will have beneficial effects for all." So this is a key issue in terms of the discussion of the distribution of vaccines based on global health. It's not just a matter of a moral imperative. It's a matter of self-interest for all countries. And this is a key area I think we can get into, but it's a key driver. And with that, I'll segue into what the key issues are briefly. The foremost one is equity, including this idea of equitable access to vaccines and other countermeasures. Second one is a One Health approach to especially prevent future pandemics. Third is to more operationalize pandemic prevention and surveillance. Fourth is to address the issue of pathogen access and benefit sharing. And the fifth is to address sustainable financing so that the implementation in these areas can all work continuously to advance global health interests. So I'll stop there. Thank you, Catherine.
Thank you, Stephen. And you touched on exactly really what I think are some of the core issues that I want to circle back on, including the future proofing as to what the next pandemic might look like. And of course, the key issue of equity. And as you say, oftentimes we can think about equity and equal distribution of vaccines in particular, and how the global world is treating lower income countries as a matter of moral imperative. But as you say, and it sounds like is acknowledged in this context, it can be very much a matter of self-interest in terms of overall global response. So I want to stay with you just for 1 minute on, and I mentioned, and you mentioned, the international health regulations and reforms. One of the most notable, at least from the outside, appeared to be the introduction of a definition of a pandemic emergency. Why is that important? And how do these reforms make the world safer from pandemics going forward?
Yeah, it's a key reform. I think most observers, even close observers, are often surprised to learn that the international health regulations of 2005, which have since they entered into force, which have governed the cooperation in dealing with health emergency. Those international health regulations, known as the IHR, did not even mention the word pandemic. It wasn't mentioned. There was no definition in it. It was a gap, and it meant that invoking additional resources, additional cooperation was that much harder without a definition for that. And what was achieved, one of the things that was achieved in amending the IHRs that were amendments that were adopted at May, was that this term pandemic emergency is now a defined term, and based on independent experts' advice, it can provide a global determination issued by WHO and the Director General, a global determination of a pandemic threat. Doesn't have to be a pandemic, but can indicate the threat or a high risk of a pandemic occurring. And this can mean, in a word, stepped up international cooperation. And it may mean much more than that, depending on the outcome of negotiations on the pandemic agreement. There could be additional mechanisms that are triggered with a determination of a pandemic and emergency. And for those of your listeners who may be concerned about WHO's authority to make such a determination, very important to recall that the international health regulations provides a robust system of member state involvement and expert level checks and balances on any global health emergency, whether it's a public health emergency of international concern, whether it's a pandemic emergency. There are checks and balances that countries have built into the system for the issuance of any determination of such a global health situation.
Thank you. And certainly those kinds of threshold questions and the consensus around the definition of pandemic emergency has significant implications. Kenneth, I want to pivot to you for another implication. Why was putting a year on the clock for the pandemic treaty so important?
Thank you, Catherine. It's a great question. And in fact, the work for the pandemic agreement through what's called the INB, as well as the work on amending the IHR through another intergovernmental body, the WGIHR, has always been on a clock. As I know you know very well, and listeners know well, multilateral treaties and instrument negotiations can often take an extended period of time to come to finalization. When WHO's member states decided to take these actions, they gave, as you mentioned at the outset, about 2 years for each of them to be done, which was, everyone knew, even at the time, quite ambitious. And that was done in response to the lived experience of the COVID-19 pandemic and the need to set up these new multilateral instruments as quickly as practically possible. So when we got to the Health Assembly this May, the mandate was to finish the work of the INB then. And as reflected in the document that went to the Assembly, there was what's called green text on many articles and yellow highlighted text on many others, showing that member states had come to agreement on many of the provisions, and the finish line was in view. So that's how you see the decision to finish up this work, which, as you mentioned, is to finish it as soon as possible, which could be a special session of the Health Assembly even during this year, or the endpoint would be next year if that's not done. So I do believe the member states wanted to get to the finish line, keep the pressure up because of the nature of this topic and because the finish line is in sight, but also making sure that time was given to set up this new legal instrument and ensure that the text is appropriate and other aspects. Thank you.
Thank you. And certainly it makes sense that keeping the finish line well within sight is important with such an urgent topic as a potential next pandemic. Let me stay with you, Kenneth, for a moment and talk about something that Stephen mentioned at the outset, which I think is really important, is the idea of future proofing. have the discussions around the pandemic treaty considered possibilities that the next pandemic will look and feel very different from COVID-19? How might a pandemic agreement address the unpredictability that's inherent in pandemics?
Absolutely. We've seen that throughout the negotiation process. Member states and the Secretariat have been very mindful of that. Our Deputy Director General, Dr. Mike Ryan, has often said, we can't fight the last war through this instrument. It has to be addressing the future. So member states are very mindful of that. One means by which that's been done is, as Steve mentioned, the definition of pandemic emergency in the IHR, which is then proposed to be flown through to the text of the INB. So those two international instruments are working in a coherent manner. The IHR takes what's called an all hazards approach to public health emergencies. It doesn't necessarily have to be a specific type or a pathogen or virus, et cetera, And the definition of a pandemic emergency, which member states agreed to, is a communicable disease, any type, right? Certainly doesn't have to be COVID-19, could be anything in that regard. Furthermore, the actual text of the pandemic agreement that has been discussed by member states so far, it's not focused on COVID or any specific disease or variant, et cetera. It's a broad political commitment in the event of a pandemic, and even to prevent pandemics writ large. Steps will be taken.
Thank you. Stephen, please.
Yeah, I'm raising my hand just because I wanted to answer a question that may be in the minds of your listeners when we're talking about a finish line as soon as possible and within a year. There'll be some listeners who hear that and say, that sounds good. We need to be better prepared as soon as possible as countries for the next pandemic. There's lots of headlines that in the US particularly and in other places about influenza as a possible pandemic. And that still may be a significant risk. But there's, I think there may be other listeners who say, why rush it? This is complicated. Why not take more time? And I wanted to give one response to that. And that's to look at how these negotiations among countries, and we are the Secretariat, we serve countries, but countries send delegations to Geneva to negotiate this. Those delegations are composed of individuals. And I wanted to sort of really open up this window into how the negotiation of any international instrument is very much a human affair involving people and often key individuals who develop trust among their colleagues, who develop a shared knowledge base among the delegations, how important that is. And the reality of of ensuring that key people and this shared sense of understanding of the issues is available to conclude agreement is very important. We are already seeing this summer key individual delegates moving on. They're members of their diplomatic corps of the various countries. They have other assignments, and we lose that knowledge, that influence, that camaraderie that exists to find solutions to problems that come up. And so by moving more quickly, by the Health Assembly saying as soon as possible, because this was countries which said that, it also seeks to capitalize on this human factor of ensuring that these representatives of countries who have gained knowledge, expertise, and who are able to understand the way their countries and the way other countries think, that those individuals maintain an active role in the process. That's very important. And that also, I think, helps underscore how it is countries that are really in the driver's seat, running this show, and their interest in ensuring that their experienced drivers maintain their hands on this wheel.
And I imagine, Stephen, that at the same time as maintaining hands on the wheel, it obviously assists with buy-in when it comes time to implementing hopefully a pandemic treaty in the future. So let me stay with you, Stephen, for a moment and talk about the role of science. Certainly in the climate space, I've seen where the objective basis of science can come in and very helpfully cut through what may be otherwise a political morass and divisiveness around certain issues. So I want to talk about science and the COVID-19 pandemic. I don't think I'd be shocking you or anyone listening if I observed that there were times where policy was not always in alignment with science in the context of COVID-19. So tell us, how did these negotiations attempt to harmonize inputs from scientific communities as well as policymaking communities around pandemics?
Yeah, this is very helpful to point to the foundational aspect of what we've already talked about, the international health regulations. So this is a legally binding international agreement, the international health regulations, that was structured to involve technical scientific experts provided by countries, but in their independent capacity, to advise on responding to global health emergencies. And it's often, and so how does that relate to the negotiations on the pandemic agreement? The IHR on the one hand and the pandemic agreement on the other are often referred to as two wings of the same bird. The bird in this case is the global work of countries to respond to future global health threats, including pandemic threats. And the IHRs has already been, as very much part of it, central part of it, is involving scientific experts to inform decision-making. Those aspects are part of what has been strengthened in the IHR that will, if there is a pandemic agreement that is concluded, those aspects, those mechanisms will also serve the pandemic agreement. So this is really very much baked into the existing global response system. And there's been, if I'm going with the baking metaphor, there's been considerable additional icing on that for what could be the pandemic agreement. So very much a key aspect of involving independent scientific experts. Again, all of these experts do come from countries, but they contribute their views to the organization as independent experts.
Excellent. Thanks, Stephen. So, Kenneth, let me turn to you for a topic that I know certainly is top of mind for me, and I think many of our listeners, which is the impact of misinformation or disinformation. And as we are all very familiar with in the context of thinking through the implications of social media, misinformation or disinformation is fundamentally altering the way that we communicate and indeed some of the very foundations of the global community. So focusing on the topic, of course, of pandemic treaty, I know that the WHO has acknowledged that misinformation on social media has fostered, at least in some corners, public opposition to the very idea of a pandemic treaty. And in fact, false theories have circulated, including that the treaty would force countries to impose lockdowns or vaccine mandates. Now, of course, we're very familiar with the issues and interplay between credible journalism and theories put forward on social media and the negative impact that can have. But I'd like you, of course, to focus here with us about that dynamic in the specific context of the pandemic treaty negotiations. What should we be worried about in this context?
Thanks, Catherine. It has, as you mentioned, been a component of the treaty negotiations, I think flowing further from the COVID response and the global pandemic that was experienced. And it's understandable from a perspective of human nature and a need to find an explanation, one could think. One aspect of the INB's work that was quite interesting at the outset is that we as the Secretariat were requested to hold public hearings and then summarize those for member states. This was done through online platforms and technology modalities so that the broad public could come and have a few minutes to speak and explain their views on the pandemic treaty and this process overall. And that was recorded and summarized and sent to the member states and was used as one aspect to actually allow people to present their views and positions. Now, during the further negotiations of the instrument, there have been statements, a lot of them on social media and otherwise. As you mentioned, our DG Tedros spoke to those. We have expert folks in our communications team here at the WHO Secretariat who do this as a professional aspect, and that's their lane of expertise. I do think one interesting aspect from a legal international law perspective is that in the current draft of the pandemic agreement, there's an article, Article 22, which addresses the role of the Secretariat to the instrument. And it has text that member states have, in principle, agreed to, which expressly addresses this directly and says, nothing in the pandemic agreement shall be interpreted as providing the WHO Secretariat any authority to direct, order, or otherwise prescribe the laws or policies of any party, or to mandate things such as lockdowns, travel bans, etc., the things that people are really worried about. So as a legal drafting perspective, to address these public concerns and comments, the member states agreed to actually put a provision in the instrument, clearly stating that and expressly providing that that's not for the WHO Secretariat. No new such powers are given under this instrument. Thanks.
Thanks. That's really helpful to know. Somewhat unusual, but I think a very good example of how a multilateral country-driven process can actually take account of what the views are in terms of points of public concern. So that's really interesting. So let me get to my final question, and Stephen, I'll turn to you for this. And this is where I'm going to ask you to peer into your crystal ball a bit. So from the perspective of our listeners, the context of international law, the progressive development of law, and the manifestation of international law is very much of interest. And if I go back to the climate change context again, it certainly is true that treaty making can be an iterative process. And in that context, we had the establishment, of course, of the UNFCCC, and then that led to the Kyoto Protocol and the Paris Agreement. I want to talk about that iterative process in this context. Do you see the pandemic agreement as the final destination of the process for international pandemic law, or the beginning of a new framework? Where else might we be headed in the future?
Yeah, I think one of the fascinating things about international normative practice is that an iterative approach is more and more standard operating procedure. And that's because whatever the problem is, the dynamics around it are very dynamic. And so I think you see in many areas this development of almost a sort of an institutional approach to the problems that these treaties are aimed at. I think a great example of this is the Montreal Protocol on the ozone layer. And those many remember from some time ago, the concern about the hole in the ozone layer. And this sort of, I think, adequately unheralded instrument, the Montreal Protocol, is really a series of instruments that over time iterated very scientific, evidence-based responses to address a common global problem. And I think this kind of approach is very much in the mind of negotiators, in that they are already structuring the final provisions of the pandemic agreement draft to allow for the development of protocols and of annexes. And indeed, it's anticipated that a number of the key issues I mentioned at the start of this would or could be addressed through such protocols and annexes. This is not to say that the pandemic agreement is a framework agreement. It is not a framework convention. It's not titled that way, and it has very substantive provisions. But it is to say that it's understood that both that future-proofing the instrument and providing response to a dynamic situation of global health threats will require a sort of institutional approach to the development and implementation of the pandemic agreement. So my crystal ball would be that, yes, very much this is going to be a process going forward with key milestones. First key milestone in the view of member states, and clearly their aim, is the adoption of the pandemic agreement to support global health response to future pandemics.
Thank you so much. And I love ending with that note, Stephen, just in the sense of reminding, for example, with the Montreal Protocol, that there are good examples of an effective global response to an issue of the global commons. And that is a good news point that we can think through in terms of the various issues facing humanity. So thank you for that. I want to thank both of you and Stephen, Kenneth, for spending the time with me today. This has been really invaluable in catching up on where we are when we think about future proofing going into potentially a next pandemic. So thank you for your time. I've really enjoyed talking to you today.
It's been a great pleasure for us. Thank you, Catherine.
Indeed. Thanks very much.